The United States faces a national addiction and drug overdose health crisis. The 2020 National Survey on Drug Use and Health reported that some 40,300,000 people 12 years old and older had a recent substance abuse disorder. That's 12% of the U.S. population, 3 out of every 25 people. It's a crisis that can strike anyone, while quality, affordable care is out of reach for many, many who end up in prison. In this spiritual journey, you'll hear from a man who's walked the journey of addiction and recovery, and who is determined to offer his testimony as a lifeline to others in need of support through his work at the Hazelden Betty Ford Foundation and its collaboration with Emory Healthcare to create the Addiction Alliance of Georgia. Meet William Cope Moyers, his spiritual journey in his own words.
I've been to treatment at Hazelden in 1989 the first time, and then again in 1991. That was in Minnesota. I had 3 years of continuous abstinence, and I emphasize abstinence because I don't think I was recovering from the illness as much as I was just not using. And I moved to Atlanta. I became a father twice to Henry and Thomas, who were born here. I worked for CNN. Tom Johnson helped me get a job, but I'd also been a very successful newspaper journalist in the 80s in Dallas and in New York. And I had a relapse of my condition. My disease of addiction came back. And all of a sudden, I went from being abstinent and working at CNN and being a decent father and a decent spouse to hiding out, in my instance, living, quote unquote, in a crack house, meaning that I was there more than I was anywhere else. I was living and dying in a place that knew nothing except despair and getting high. It happened to be at the corner of Boulevard and Ponce de Leon. Now that area's changed since then. I was there a couple months ago and it's been gentrified, just like a lot of sort of inner cities have been. But I was in a crack house, getting high. And not doing anything else, really. And that didn't work very well, right? Not only did everybody miss me, but everybody noticed me. So the people that knew me missed me because I wasn't showing up at work or being a good dad or mowing the lawn over there at Noble Drive. And all the people that noted me were people who were a different color than I was and knew that I was a strange guy because I was not like everybody else in the crack house, but I was in the crack house just like they were, and I was smoking crack or trying to smoke or trying to get high or drinking malt liquor, and it didn't work very well. So I went to treatment in the summer of 1994 after CNN said, you know what, if you don't get your act together, you're going to get fired. So I pulled myself up by my bootstraps. I complied. I went to treatment for 3 weeks up in Smyrna. And then I came back and I stayed dry for 66 days in a clinical depression. And on October the 8th of 1994, I left. It was a Sunday afternoon. I said to my wife, I'm going to go run some errands. And I went back to the crack house over there at Boulevard and Ponce. And I stayed in there for 4 days and 4 nights. Meantime, people were looking for me. And on the morning of October 12th of 94, 2 deputy sheriffs from the Fulton County Sheriff's Department came knocking on the front door of the crack house. And they said, we want the white guy, just the white guy. We know he's in there. He comes out now and there's no trouble for anyone later. I was the white guy. They weren't looking for anyone else because those deputy sheriffs had been sent there as part of an intervention. My church, my employer, my boss, my family, my neighbors, my doctor, they said, we got to save William Cope before he dies. So they mounted an intervention that included 2 deputy sheriffs because it's a dangerous thing, a crack house in the inner city of any inner city. And they came in and knocked on the door and they said, we want you to come out. But they couldn't make me come out. I was an adult. They weren't going to make me get treatment. Couldn't. But I went because the heat was on and because I had a flicker of hope, you know. And so I went outside and there was a van parked in front of the crack house on Ponce or on Boulevard, and inside that van was my father. He was in the front seat with the interventionist, and the 2 deputy sheriffs put me in the back of the van, and my father turned and he said, I hate you. And I said to him, I hate me too. That's how powerful that moment was. The substances had taken us all down. You know, my father didn't hate me, but he didn't know how to express his fear, his utter fear, his frustration. And I didn't hate me either, but I was filled with shame, and I didn't, I felt like I was a failure. I was a loser. I was sick. And that's the story. And, they didn't come knocking on the door for anybody but the white guy. And they took me back up to the treatment center up in Smyrna, Ridgeview, and I stayed there for 100 days. Why did I stay there for 100 days? Because A, I had insurance, B, I had money in the bank, and C, I wanted to get well. I had 2 baby boys at home. I wanted to be their dad. I had a good job at CNN. I owned a home. I was happily married. I was really sick. I wanted to get well. Atlanta is the ground zero of my redemption, where I turned that corner from being an addicted person who was draining the community to being a man in recovery who could give back.
That includes working to create the Addiction Alliance of Georgia.
A couple of years ago, we were approached by this remarkable community of Atlanta and Georgia and asked to bring Hazel and Betty Ford and our services here. Easier said than done, right? But I've always had a special place in my heart for this community because this community did for me what I couldn't do for myself. So today, through this Addiction Alliance of Georgia, I am one of many members of the team in conjunction with Emory University, trying to create opportunities for people to get what I got in 1994, which is another chance.
Moyers says he's living proof that addiction is an equal opportunity illness.
There's so much stigma around this illness. There's a lot of private shame and public intolerance. So that's a lethal cocktail, no pun intended. And oftentimes the stigma of addiction keeps people from asking for help, or it keeps people from getting help. I'm a prime example of the fact that addiction doesn't discriminate, that you can come from a family of means and prominence, as I do. I lacked for nothing growing up, emotionally, morally, financially, and spiritually. My father, the journalist Bill Moyers, before he was a journalist, before he was Lyndon Johnson's chief of staff, before he was deputy director of the White House, of the Peace Corps, my father was an ordained Southern Baptist minister, so I had a fundamental understanding of a power greater than myself up there, wherever that is. And so thus I am exactly the opposite of what oftentimes the public or the policymakers, the news media think that addicts and alcoholics are, because I had everything growing up. And so my passion, Audrey, has been to, use my own story to prove that addiction does not discriminate, but also to emphasize that recovery shouldn't discriminate either. And it does. We just know that it does. At Hazel and Betty Ford, through the Addiction Alliance of Georgia, we know that people don't get the same sort of access to care that I got. The color of your skin, your religious beliefs or lack of religious beliefs, whether you have health insurance or not, whether you're employed or unemployed, those shouldn't be factors when it comes to addressing substance use disorders in Atlanta or in Georgia or in Minnesota or anywhere else. People who are suffering from addiction should get access to treatment, quality, appropriate treatment, oftentimes more than once. And we know that too often people believe that addicts are people who live under bridges on I-85 or don't go to synagogue or do go to synagogue or are unemployed or are some other color. Addiction does not discriminate. And so I've used my own story to to emphasize that, because when you can come from a family like I've come from, I don't come from a broken home. I lacked for nothing growing up, and still I got this vulnerable brain and I've got this hole in the soul. Addiction is not an excuse, but it is an explanation as to why good people can do bad things, and rational people can act irrationally, and moral people can act immorally, and loving people can hurt those that love them or that they love. I've got a brain that's vulnerable. Addicts just have one of these brains, and science is way better at explaining it than I am, but I just know that I've got one. What it means is that when I voluntarily ingest a legal or an illegal substance into my body, it goes into my brain, and my brain processes those substances differently than it does with 80 to 90% of the rest of the population of Atlanta, because about 1 in 10 of us in any community are vulnerable to addiction. It's because of this brain. And I can't explain it, but I know I got it. And so when I voluntarily ingested marijuana at the age of 15, a long time ago, and legally drank alcohol at the age of 18, off to the races I went. Why? Well, not only did I like what those substances did for me, but they hijacked my brain, because I couldn't stop of my own free will. That's the layman's description of what it means to have a genetic predisposition or a vulnerability to the illness in the brain. And again, I'm not a doctor, I'm not a therapist, I'm not a licensed counselor, I'm not a researcher. I'm just a man in long-term recovery from addiction who's worked at Hazelden and Betty Ford for 25 years. I've also got what I call a hole in the soul, this sense that I'm not good enough, that I need to be better than. It's what I describe the hole in the soul is something that's unique to the human species. It's called yearning. There's nothing wrong with yearning. It's why we want to go to the moon or become a rabbi or be a teacher or run a marathon. There's nothing wrong with yearning. It's part of the creative process. But some of us yearn for something that we can't have. And what is that? It's perfectionism. Or, and no one can be perfect because we're all human. But when you've got a vulnerable brain and this yearning for something better than, and you ingest substances into that body, well, it soothes this hole in the soul. But it also hijacks this brain, and then boom, you end up out of control. You end up in a crack house like I did at the corner of Boulevard and Ponce. You end up having a second DUI, whatever it is. Again, addiction is not an excuse, but it is an explanation.
Almost 3 decades in recovery and committed to sharing the story of his journey in public and private, William Cope Moyers is all too familiar with the current drug use epidemic.
I'm going to tell you right now, in the spring of 2022, I've never had more people reach out to me who were sicker than they are now. And why is that? Because everybody's been isolated. Everybody's been masked up, literally and figuratively, for 2 years. And so people have avoided each other. They've avoided their families. They've avoided getting help for whatever their ailment. But when it comes to mental illness and addiction, this pandemic has exacerbated that condition by keeping people from getting help, or that sense of desperation that comes with isolation. The Centers for Disease Control and Prevention reported that between April of 20 and April of 21, 100,000 people in this country died of accidental overdose. That was a record. That was a record that had been set in 2020, 2019, 2018, and all the way back. Now, 4 years ago, we were wringing our hands when the CDC reported that the number of accidental overdoses was something like 60,000. And we were saying that's more than died in the entire war in Vietnam. And now it's 100,000. So mental illness and addiction, there are illnesses that do not discriminate. There are also illnesses that have fed off this pandemic in the sense of the isolation, the stress, the trauma, and all the other changes in dynamics which have kept us apart as the human species that oftentimes finds strength in numbers. It's scary. And the people that I deal with on a day-to-day basis reach out to me through Facebook, visit me in my home in St. Paul, Minnesota. Contact me after the article in the Jewish Times. I mean, they're really sick. They're really, really sick because they've been putting off what they or their loved ones needed, and it's scary.
And while care is not available for all who seek it or need it, addressing that disparity is part of the mission of the Addiction Alliance of Georgia.
Within the community of people who are struggling with addiction, too oftentimes access to care is defined by either the color of your skin or whether you have health insurance. And that shouldn't be. That just shouldn't be. The Addiction Alliance of Georgia is not a cure-all. It's not the solution. It is part of a solution that includes embracing the reality that addiction is an illness that doesn't discriminate, that many people in Georgia struggle with it, and that everybody should have access to care. We're only going to treat a thin sliver of the problem through the Addiction Alliance of Georgia, but when you add up those slivers, it gets to the pie. And hopefully, eventually, we will have expanded access to care in such a way that anyone in Georgia who needs treatment can get it. It was also made very clear to us that in this partnership between Emory Health and Hazelden Betty Ford, that we couldn't just be satisfied expanding access to care for middle class or people with resources, that we needed to address what is a really serious problem in Atlanta and in Georgia, which is addiction among those who don't have resources. And so that's part of our commitment through our fundraising, be able to create patient aid funds, to be able to provide treatment on an outpatient basis, not just a residential basis, so that people can go to work or go to school or be at home with their families when they're not getting treatment for their addiction. That's really important as well.
All along, William Cope Moyers' trust in the divine never wavered, though it did evolve.
I believed in God. But through my own addiction challenges and my journey of recovery, what I have come to understand is that for me at least, it wasn't enough to just believe in God. What I needed to do was to trust in God, that God could do for me what I can't do for myself. Well, that was a big deal, that's a big transformation, because I've come to understand, and again, I believe that religion and spirituality are unique to each one of us. I can't tell you how to believe or how to practice that belief. I can only tell you how I do it. I used to believe that religion was a destination, that I needed to get there, right? But what I've learned is that mine is actually a journey of spirituality, and how I choose to interact with my higher power, it evolves. It evolves along that journey. Again, trusting that God can do for me what I can't do for myself. Oftentimes, trying to quiet my busy brain long enough to listen for that touch point, And candidly, in my story of addiction and redemption, that transformation for me occurred when I came out of that crack house in 1994 and was on suicide watch at Ridgeview Institute in Smyrna, Georgia, the treatment center where I found my ultimate launch pad for recovery, if you will. And I was lying there in the detox on suicide watch, and it still gets me 28 years later. I was flattened. I didn't have an answer to the question, now what? Now what am I going to do? I could not answer the question. Remember, I've been through treatment multiple times in the late 80s, early 90s, had 2 baby boys at home, I worked at CNN. I couldn't answer the question, now what? And that was when I began to listen. It's hard for me to listen because I got a noisy brain, but I had to listen for sort of that gentle persuasion, that gentle influence. that I believe came from my higher power. And it was through that process that I knew that I couldn't do it my way anymore if I was going to recover. And it worked. You know, it worked. A lot of people say, oh, well, you got God's grace. But I don't believe in God's grace. And again, this is me speaking. I don't believe in God's grace, because if God's grace is omnipotent, then everybody would get it. But last year in this country, 100,000 people who are like me, they're addicted people, most of them, they didn't get God's grace. So why not? So is it luck? I don't know why I recovered, except that I just got access to care again. I had a really good group of professionals who were working with me. I started listening to a power greater than myself, and I worked my part of the deal, if you will. You know, you can't be flaccid or benign if you're going to recover. You've got to do the work. And that combination saved me from a disease that almost killed me. I'm fortunate that I have a belief and a trust in God, but I don't think God picks favorites and says, you know, William Cope, you're going to recover because you're worth it. And, you know, Scarface, who was a man that I knew in Atlanta, inner city Atlanta, Scarface, you're going to get shot to death because you're going to get shot to death. I don't think that God plays favorites or picks those of us. But that's just my belief. It doesn't mean that I'm not grateful. In fact, gratitude is the elixir to my own ego at times, and I think I get a lot of credit for this stuff. You know, there's not a night that I don't go to bed that I don't thank God for the gift of another day, because I should be dead multiple times, you know, for my addiction. And when I thank God for the gift of another day, it oftentimes is rooted in the fact that I've helped another person or another group of people or a community or the viewership of your program. And when I have a high level of gratitude, I also have a high level of humility, because I recognize that in some ways I'm here despite me. And I'm here despite this illness that I have, this chronic disease of addiction. Because, you know, I've been in remission from my disease for a long time, but I'm not cured of it. There's no cure for addiction, any more than there's a cure for diabetes or hypertension or asthma yet. And so I have sort of a daily reprieve. And that daily reprieve is a gift. And what's the best part about a gift is not only receiving it, but giving it away to others. And so when I get the gift of another day and I give it away to others, then I go to bed at night and I'm grateful for the day that I've just had. And when I get up in the morning, I'm grateful for the gift of the day that's coming. And I thank God, and I thank my community of recovery, and I thank my employer, and I thank my family for being part of my journey. Addiction is an illness of isolation. It's a lonely disease. How could it not be? It's filled with hopelessness and shame and stigma. But the antidote to it is community, the faith community, the recovery community, the community. If we want to address addiction in Atlanta or in Georgia, we need to do it from a community approach. Why? Because the most important change that can occur in a community is when the community comes together to change. and in the same way that addiction is an illness of isolation, and that the way that I and so many countless others recover is with each other. It's why when a ship sinks, the survivors don't swim away from each other. They swim to each other. They get in the lifeboats. They hold on to the wreckage. Why is that? Because there's salvation in us being together, even when we are suffering, even when we are struggling. Best that we suffer or struggle together than suffer and struggle apart. And the power of community to make change really is representative of the power of community to recover. I don't recover by myself. I recover in the community. And for me, part of that is giving back in this way that you and I are sitting here talking in the studios. If I don't give away myself and give away my story to the rest of the community, to those that suffer, then what good is it? So I'm a public advocate for the organization, not because I want to raise visibility around Hazelden and Betty Ford of the Addiction Alliance of Georgia, but I'm a public advocate because I want to give people hope. And by the way, when I do that, I get it back. And I think that's true no matter what your cause is. When we give away ourselves to others, particularly when it's related to the intimate struggle of something like an illness, we get it back. And when I get it back, I'm going to be okay.